The following is a supplemental video for the University of Kentucky College of Dentistry Oral Photography class. All material presented in this video is adjunct to the basic instruction provided in our lectures. We will first begin with extraoral photography. There are several camera options. For this video, I am using a Canon Rebel SL2 with a 100mm macro lens and a macro ring light. To begin, have your patient stand behind a plain, preferably white background, about 3 feet from the wall. On manual, set your camera to f8, speed 1/125, ISO 100. Keep in mind that for any of these photographs, you will need to adjust your camera settings accordingly based on the outcome of your images, but these provide good starting points. For the straight-on photograph, both sides of your ring light should flash. Once your patient is positioned, frame the patient's face so that the top of the frame is just at the top of the head and the sides are at about the ears. The objective is to minimize the amount of background in the photo. For the extraoral photographs, the patient can smile, relax, or reach the high E position according to the shots you want to capture and your clinical objectives. For the side profile, you need to turn off one side of your flash. You do this by changing your flash ratio to one side, usually using a toggle switch, and turning your flash so that the hot flash, or the active flash, is on the side of the nose. To achieve this, I usually turn off my left flash, then move my flash counterclockwise 90 degrees, and have the patient so that her nose is on your left. Frame the face so that the top of the head is the most superior part of the frame, and you just capture the tip of the nose. How much of the back of the head you get depends on the patient's head shape and is not important for the photograph. To position the patient, have her turn her head towards the wall and slowly move towards the camera until you see either the first hairs of the opposite eyebrow, the tips of the eyelashes, or the opposite side of the philtrum. Then shoot your photograph. Here's an example of some common errors for this shot. First of all, you've not zoomed in enough. Too much of the wall is showing. The top of her head should be at the most superior part of the photograph, and the tip of her nose should be at the left border. The image, therefore, has come out darker than desired. Additionally, the flashes are not at the correct position. The hot flash is facing the back of her head, casting a shadow around her face. Always keep the hot flash on the side of the nose and minimize the amount of background in your frame. When changing between the side profile view and the full facial view, do not touch the lens. Adjust the focus by moving your body so that the size of the head stays consistent. You may want to have your patient remove his or her glasses, as the reflection can cause your images to turn out dark. Now we will move on to intraoral photographs. To do this, set your camera to f22, speed 1/125, and ISO 100. Make sure both sides of your flash are on. The additional gear that we use for the standard adult patient and photography set include a set of plastic cheek retractors, metal cheek retractors, the 1B, 2B, and 4XL mirrors. The primary use for the plastic lip retractors is for the anterior facial shot. After that, we recommend using the metal retractors. Before starting any intraoral photography, have the patient lick her lips to prevent cracking. It may seem instinctual to apply chapstick or lip gloss. However, when the patient does that, it gets all over the mirrors, so I don't recommend that. For the anterior facial shot, place the plastic lip retractor so that the handle is parallel to the floor. To prevent the lips from bowing inward, pull the retractors forward towards the camera. Throughout all of these photographs, keep in mind that while your assistant may place the retractors or mirrors, the photographer needs to guide the assistant based on what he or she sees from the camera's point of view. Also, ask your patient to position her head to make it easier for the photographer when possible. Here's an example of the anterior facial shot. Ideally, the midline should be in the center of the photo, all teeth are in focus, the lips are not bowing significantly towards the teeth, and the occlusal plane is parallel with the top and bottom of the photograph. When taking the photo, focus on the most anterior portion of the photograph. Here, that would imply the central incisors. This photo illustrates the tendency of the lip to bow inward when the retractors are not held outward towards the camera. Here, the photographer did not center the midline of the teeth, and she did not zoom in enough. This next photo demonstrates what happens when the camera is set on auto. Notice that all of the teeth are not in focus. The photographer used the incorrect angle in this photograph, and in this image, the camera was set to the wrong aperture. Next, we will move on to the buccal shots. For this image, we will use the metal cheek retractors and the 1B mirror. Use the large end of the metal cheek retractor as the mirror slips into the space appropriately. Often, you'll have to have your assistant place the retractors for the patient, retracting more on the side of the photograph and relaxing the contralateral side. Once the retractors have been placed, it's easiest if the patient holds the retractors so that the assistant can hold the mirror. Mirror retraction for this photograph can be tricky. We obey the rule of 45 and 45. The mirror should slip in the vestibules parallel to the teeth. Then the assistant moves the mirror to a 45-degree angle to the teeth. The photographer will then take the photograph at a 45-degree angle to the mirror, creating an ideal 90-degree angle to the teeth. Once the assistant places the mirror at 45 degrees, she will then move the mirror buccally, making sure to maintain the same angle and ensuring the mirror is not resting on the alveolar ridge. That movement is often quite uncomfortable for the patients, so we always recommend that the photographer get set up and ready to take the photo prior to moving the mirror buccally. As an aside, to minimize the amount of bubbles, like in this photo, remember to ask the patient to suck in air prior to the photo, or have your assistant dab the area with gauze prior to snapping, although sometimes it's unavoidable. Also, to decrease the amount of mirror fogging, soak the mirrors in warm water prior to putting them in the patient's mouth and ask her to breathe through her nose. If fogging still occurs, see if the assistant can blow light air on the mirror during the photograph. A common problem with the buccal shots is incorrect zoom and mirror placement. Here, the photographer should have slanted the mirror downwards and moved in slightly so that the edges of the mirror were not visible. The ideal photograph captures the distal of the canine to the distal of the last tooth. Also, the assistant's glove is visible in this image. She cannot see what you see, so always remember to direct. Here is an exaggerated demonstration of the mirror placement on the contralateral side on the model. The mirror is slanted slightly upwards in this clip, but the 45-degree angle and buccal movement can be seen. Here we demonstrate the same technique, but on the opposite side. The photographer gets ready to take the photo, then tells the assistant to move the mirror buccally. This image shows the mirror outline, but overall is not a bad shot. This photograph demonstrates what a photo may look like if fog gets on the mirror. The next images we will take are the lingual shots. We use a 2B mirror for these. Certain photographers like certain ends of this mirror. I tend to place the rounder end of the mirror into the patient's mouth, but I'll leave that up to the photographer. For the mandibular shot, slide the mirror into the patient's mouth in between the tongue and the alveolar ridge. Then, angle the mirror from the retromolar pad to the canine area. Once you have that angle, push the mirror towards the tongue, keeping it at the same angle. Again, you'd like to zoom in enough to see the distal of the canine and the distal of the last molar. Also, remember to have the patient move the retractors so that no lips are in the way of the photo. For these shots, the assistant is usually on the opposite side as the photographer, so to minimize the amount of musical chairs, take the lingual of the maxillary teeth on the same side by just moving the mirror upwards. Just remember not to slant the mirror too much. Here, the assistant was using the opposite end of the mirror for demonstration. However, I prefer the more rounded end, which seems to fit into the palatal vault a bit better. This photo is good. You can't help seeing the retractor in the background unless you use tissue blockers, which we will touch on briefly at the end. Again, here's the same technique but on the contralateral side. This is a decent photo. However, in this second photo, you see more of the occlusal plane. To correct this, just angle the mirror more parallel with the long axis of the tooth. Or, in other words, tilt the top of the mirror slightly towards the contralateral side. We put this image in to show incorrect exposure of the image. This image is too bright. Lastly, we will take the occlusal shots, starting with the mandible. To do this, we lay the patient flat or declined in the chair, then tilt her head back as much as she will tolerate. We use the 4XL mirror for these images. Place the distal end of the mirror on the retromolar pad and tilt the mirror as far open as the patient will allow. On the patient, place the cheek retractors to pull the lower lip towards the patient's feet and have her hold them. Then ask her to put her tongue up to the roof of her mouth before placing the mirror. That way the tongue does not block any of the teeth in the photograph. Once the patient is set, Ask the patient to tilt her chin upwards as much as possible, as shown here, and then snap the photo. It helps the photographer if you lower the chair towards the ground as much as possible. We will do the exact opposite for the maxillary arch. Place the mirror on the maxillary tuberosities, then tilt it as much as possible. Have the patient hold the retractors, pulling her upper lip towards her head, tilt the chin upward, and take the photograph. You want to capture the whole arch. How much of the surrounding tissue depends on the width of the arch and may not reflect operator conditions. The image can always be cropped afterwards. For the maxillary arch, the patient often isn't happy when you can see up the nose. You can block the nose by pulling the retractors more in that direction. This concludes the standard set of intra and extraoral photography that we take at the school. Other shots can be taken based on the clinical interest. Additionally, some photographers like to use contrasters to block soft tissue or contrast colors. Here is an example of the mandibular lingual shot using a contraster. If you're taking a photograph of a soft tissue abnormality, remember to dry the tissue off so as not to have a glare in the photograph. In this photograph, there is a glare overlying a leukoplakia, so it's difficult to determine the extent of the lesion, as opposed to this image in which the photographer dried the tissue off prior to the image. Finally, there may be times when you want to cast a shadow. For example, when taking a photograph of a mass, it may appear flat or only slightly raised if both flashes are used. In this image, this fibroma almost appears flat, whereas in this photograph of a different patient, the left flash was turned off, so the viewer could undoubtedly appreciate a raised lesion. That concludes our video tutorial. Remember that there are no set rules with intraoral photography. If your images are not coming out as you'd like, adjust your settings and technique. Thanks for watching.